Well, we're fortunate to have some experts in the room. We know that there are pillars that keep our foundation strong. When one weakens, another must compensate, but is also weakened. And when one crumbles, the foundation is lost. These pillars are health and behavioral health, housing, and financial stability. Good health, a roof over your head, and a job. Our services focus on these pillars, and our panelists in the room are experts on these pillars. So I am pleased to introduce our moderator for this discussion, Fred Thys. Fred reported on politics, higher ed, and veterans at WBUR from 1998 until this year. Prior to joining BUR, Fred was the Mexico City bureau chief for NBC News. He managed a team covering Latin America, including a highlight such as directing coverage on the takeover of the Japanese embassy in Lima by guerrillas. Before that, Ted produced news for CNN International and was their New York bureau. I'm pleased to turn over the mic to Fred Thys. Fred?
First, we have Senior Chief Petty Officer Keith Jermyn. He's a lifelong resident of Hingham. Keith began his naval career in 1985, just one day after graduating from high school. Keith's deployments included combat operations in Africa and in the Persian Gulf. He served in both Desert Shield and in Desert Storm. He retired from active duty in 1993, and he began his civilian career as a licensed electrician with Local 103. However, after witnessing the horrors of 9/11, Keith returned to service. He affiliated with the U.S. Navy Reserve, and subsequently, his unit was twice deployed overseas, pressed into service during Operation Iraqi Freedom in 2005 and in 2008. Today, Keith serves the residents of Hingham as Certified Commonwealth of Massachusetts Veteran Service Officer. He's received numerous medals, awards, and citations, including Navy and Marine Corps Commendation and Achievement Medals, the National Defense Service Medal, and the CB Combat Warfare Specialist insignia. Colonel Bob Notch served in the Army for 27 years, and today he serves as the Program Development Officer at Brighton Marine. He's passionate about serving uniformed service members, veterans, and their families. His work at Brighton Marine is developing collaborative partnerships with military and veteran family service partners through a physical and virtual hub that streamlines the connection between the veteran client and the service provider. And in addition to his role in building a veteran network community at Brighton Marine, Bob is president of the Greater Boston Veterans Collaborative, co-chair of Our Community Salutes Eastern Massachusetts Planning Committee, and first vice president of the South Shore chapter of Military Officers Association of America. Ted Louis-Jacques is a U.S. Army veteran and a corporal of the United States Army Reserves. Corporal Louis-Jacques enlisted in the Massachusetts Army National Guard in 2014, and he was deployed in the Middle East in support of Operation Enduring Freedom. He returned home in September 2016. Ted currently serves as Director of Veteran Services for the City of Somerville, and previously he served as lead liaison in the Haitian American community for the City of Malden. Ted is also the founder of Malden Rising Leaders, Inc., a nonprofit organization focused on youth leadership and development. And Ted served as class president at Mount Ida College, where he earned his bachelor's degree and also received a graduate certificate in Homeland Security and Emergency Management from Central Texas College. And last, Angela Eberle is the program director at VOAMASS's Homeless Veteran Reintegration Program. A proud Detroit native, Angela joined the VOAMASS team in 2012, and she's been part of its veterans program since 2014. She's played a critical role in expanding and launching veterans services. Angela has more than a decade of experience in the social service sector, including leadership roles, working with youth, reentry populations, addressing substance abuse, and mental health disorders. Angela practices a trauma-informed approach, working with clients in harm reduction framework. She's currently working towards her MBA and is certified in federal grants management. And I'd like to start off asking all of you, and just feel free to jump in as you will, and I will call on you if if we're not hearing from you and other people are maybe dominating the conversation. So let me just throw it out to all of you. What has been the biggest impact on of the pandemic on your ability to serve veterans?
I'll jump in if that's okay. First off, I want to thank Volunteers of America for inviting me to participate in this panel. Great group of partners that are here on with me and a great group of experts. So thank you very much. And I also want to thank Volunteers of America for being a partner with our coordinated care network to be able to serve veterans through one portal in order to get assistance. So the interesting point I want to share is, we launched our coordinated care network about 3 years ago. And to date, we've got about 40 partners that serve veterans in different capacities. And we're able to connect veterans to get the service they need through an electronic portal. They don't get lost in the system. And the struggle we had was when the shutdown happened. So April, May, June timeframe, we saw a significant decrease in the number of veterans that were reaching out for assistance. And I thought maybe that was an anomaly just with our partnerships, but in my role with the Greater Boston Veterans Collaborative, we did an informal check with the organizations that participated in that group. And many of the nonprofits saw the same thing. And I think what happened was when the services, the communities were shutting down, businesses were shutting down, people really closed in on themselves and they stopped reaching out for some of that assistance. It was still there, but I think they closed their doors a little bit. An interesting opposite of that is our partners at the city and state level noticed a significant increase in the number of veterans that were reaching out for help. So the dynamic there is really, I think like most of us, we kind of pulled into our homes and kind of took care of our families and ourselves and weren't really reaching out for that assistance. But then in some cases, they knew that they could go to my city or I can go to the state and I can get that assistance that's available.
I could.
Yeah, Ted and Keith, you want to jump in of what you're seeing either in Hingham and Somerville?
Yeah, I can definitely echo what the Colonel said, that, being one of the 250 certified VSOs in the state that's responsible for the delivery of Mass General Law Chapter 115 veterans benefits, we actually had to stand up a new program called the Safety Net Program so that qualifying dependents and veterans and their surviving spouses would be eligible to receive these benefits. And we had to change the way we were doing business. We could no longer see people face to face. We had to change the policies and procedures that were already in place for years. I mean, many years, over 100 years actually. And we did see that uptick that Colonel Notch is talking about. People realized that, hey, I'm shuttered in now. I can't get out into the public. But I know that the town hall, city hall, estate is still available for me. And we did see an uptick in bringing on qualified clients throughout the state. They need, their needs range from daily living expenses, medical costs, rent or lease or mortgage assistance, and especially fuel assistance. So those four pillars, they increased exponentially.
Absolutely. Again, thank you to VOA Massachusetts and for you guys for organizing this panel. It's great. Like the Colonel and Keith said, I would say one of the biggest thing for me was that I stepped into this role on February 10th, and 3 weeks later we were shut down. And here I am coming up, with the 30, 60, 90-day plan and everything that I thought we were going to be doing. And we just had to, again, reimagine this and figure out how are we going to best serve our veterans in the middle of a pandemic and not knowing what it was going to be like. So we did see uptake in, people reaching out to our offices. We just resumed to, phone calls and getting in touch with them that way, sending out letters. The isolation part was very big amongst veterans, feeling alone, etc. So we were able to reach out to them, getting them the help that they needed. But again, it was very tough at first. And then we started to figure out ways to move forward past this and best reach out to our vets.
Angela, what do you see as the biggest impact of the pandemic on your work with veterans?
Oh, absolutely. Thank you, everyone. I want to say it's a pleasure to be part of the panel with all of you experts. And being in the workforce development, overseeing the programs that operate with employment training for the incarcerated and homeless veterans, the biggest shift obviously has been with the shutdown that we've had to create the entire program to be virtual. There's no more going and interacting in the community at the VA, within the jails and the facilities to reach these veterans who need workforce. So we've had to use our best practices and kind of refine the program from centering it for employment purposes and ensuring that the veterans are receiving essential needs, sanitizing stuff, homes, and they have everything they need to survive during this pandemic. So we created our program to be virtual, and graciously enough, Bob Notch and Brighton Marine donated 25 iPads to Volunteers of America for our veterans to have access to Zooms and virtual appointments for mental health, any medical and other programs to receive assistance in that capacity. So that has definitely been the biggest change that we have noticed.
What do you think is, I'll stay with you, Angela, first. What do you think is the biggest need that veterans have now, and how that might be different from before, or maybe it's still the same needs?
The needs have shifted because of all of the opportunities under the CARES Act, I'm going to say. A lot of the vets right now are pretty content with some of the benefits that they are receiving. They're not really they're not looking for employment. That's not their number one. They're looking, there's a lot of them surviving right now, and housing and food and shelter are kind of taking priority over everything that's happening right now.
Keith, what are you seeing in Hingham?
Believe it or not, even in Hingham, we're seeing an actual uptick because of the isolation of suicides, veteran suicides. And then we have weekly calls, Ted and I and the other 248 veteran service officers link in with the state. We talk with the Secretary of Veterans Affairs, Colonel Cheryl Poppy, and her staff, and we get a brief weekly. And that, believe it or not, that isolation is further driving those that are already affected by mental health issues like PTSD, TBI, etc., into a more lonely world. And the end result of that is suicide. And nationally, the average has risen just in this last 18 months alone. It was at 17. We had gotten to 17, and now we're back to plus 20 again. So 20 members, military members or veterans take their lives on a daily basis in this country. And it's sad to see that this pandemic may have increased that statistic.
Ted, do you want to add anything to that from your perspective in Somerville?
Yes, absolutely. In Somerville, what we're seeing is that depending on the age group, there's a difference between the needs of the veterans. Like, for example, what I'm seeing right now from a lot of the younger vets who are, police officers, firefighters, or in different civil service jobs, is that this is a good time for them to get a VA loan. So, they'll be out there reaching out to our office to figure out how do they go about getting connected with different VA connections and anything that they need from the city or what we can offer. Now, on the older side, we're seeing folks who are in need of food, who are getting different needs of that. So I'll just leave it there to give everybody else a chance to talk. Yeah.
Bob, let me come to you. What are you seeing from with regard to addressing the issue of suicides, as you're hearing from the towns, or something else that you might want to bring up?
I'll highlight two things that we've noticed. One was the food insecurity piece, and more evident in the number of food packages that are being delivered to the veterans in the community. It was one of those issues where we didn't necessarily see the demand, the ask for help, but once it was out there, it was being received over and over again. So that is one that has shown itself just by the value of being there. And the second one is, we opened our 102 unit apartment building in February, right as the pandemic started. That building filled up to 96% full by June, July timeframe. So when you would have thought things would have slowed down and people are staying where they're at, that building continued to fill, using the proper protocols to make sure that we weren't spreading the virus. But there was still a need for housing. And we opened a second housing facility here just a couple months ago for formerly homeless veterans, and that building is full already. So I think food and housing are probably the two key things that we saw.
And can I ask you then, Bob, let's start with you, Bob, just how do you, maybe we'll have to wrap it up with you. We just got a couple of minutes, but I'll let you wrap it up, Bob. So how can people help out most with, the greater community? Where can it come in and help all of you fulfill the needs of veterans? Where do you see the most urgent need, where people can come in and actually provide you with more resources?
Well, there's so many nonprofit organizations in this state. There's over 200 that serve just veterans specifically. So it is likely that an individual find a nonprofit in their community to provide support. Take a look, see where your interests lie. If you are interested in housing, then find an organization that works with housing. If you're interested in food or employment, then find one of those. The second part is Massachusetts is unique in that every city and town has a veteran services officer in the community. And so that is one office that anyone living in Massachusetts can reach to and say, I am here to help, or how can I help is probably maybe the more important question. And that individual, these guys right here, Ted and Keith on with us today, will help kind of direct them to where they are seeing the needs. And that way you're helping the veterans in your community, your neighbors.
Well, Bob Notch of Brighton Marine, Ted Louis-Jacques of Somerville, Keith Jermyn of Hingham, and Angela Eberle of VOA. Thank you so much for this discussion and for sharing your insights.